everyone. My name is Judith Barriga from CLT en Español. And yes, today the interview is in English, and I'm going to tell you why. Because young adults and Latinos and African Americans are the groups and communities that are more affected with COVID-19. And we're going to talk about with the experts today. We started the conversation with Vamos a Cuidarnos on Monday. We thought it was important to do it also in English and to integrate more communities. Today with me, co-hosting and kind of taking over is Ohivia Phillips. She is a journalist and community activist in Charlotte. Why don't you tell us a little bit about yourself, Ohivia? That way people know who is with CLT en Español today.
Absolutely. Hi, Judith. I'm so happy to be here. My name is Ohivia Phillips. I am all things media here in the city of Charlotte. I have my own talk show, but above all, I'm a community servant. I'm an activist, and I'm just happy to be here. Really excited to kick COVID in the butt and honestly have all these important discussions so we can help save some lives.
We're going to talk about why the importance of the 6 foot distance. Why do we need to use the mask?
Yes.
Why do we still have to stay home, even though a lot of things are open, and numbers? And for that, Dr. Reynard Washington, Deputy Health Director of Mecklenburg County, is with us. And he is the voice today. So welcome, Dr. Washington.
Thank you so much. Great to be with you all today.
So let's start with that. What are the statistics? What does the number says in the state and in the county about COVID-19 in our communities?
Sure, there's a lot of data available, and so I will try to give you just the highlights from it right now. As of just a day ago, there were roughly 23,500 cases of COVID-19 had been reported in Mecklenburg County since the beginning of the pandemic. Now, the important thing to note about that number really is that though three quarters of those individuals have since been released from isolation and have recovered very well. Unfortunately, we have lost just over 260 lives in Mecklenburg County. And unfortunately, we continue to sort of have individuals in the hospitals every day who are receiving care for COVID-19 complications. The good news is we are starting to see some progress in those key indicators that we're tracking over time. So our daily case counts are starting to decline and have been on a decline for the last several weeks. We've also seen declines in the number of people who are in the hospital. So we've seen fewer people being hospitalized due to COVID-19. And a very important indicator that we track is the percent positive. So what percent of those that are tested come back positive? That number also has declined fairly significantly. What that means to us really is that we're on the right path, but it also means that we got to put our foot on the gas. It means that we now more than ever that we're starting to see improvements in our community specifically. It's most critical time for us to really take action, to really stick to doing those things that we know work very well, like you just described, wearing a mask when you're out in public and in contact with other people, ensuring that you practice good hygiene. So washing your hands and cleaning and disinfecting surfaces very commonly or very frequently, and of course, keeping 6 feet distance from others when you're out and about, particularly when you're inside of buildings. One thing that's also really, really important for us is that we don't gather. Large gatherings of a lot of people, particularly those who don't live together, are really what we call hotspots for the virus to spread. And so it's really important. I know it's tough to not see our family, to not have parties, to not have celebrations for graduations, but it's really important in during this time, particularly while we're trying to better contain the virus in our community, that we don't get together in large groups and that we really sort of try to leverage, virtual interactions as best possible. Think about having small groups with just those that you live with. If you have to have an event of some kind, for example, for a funeral or something, having those outside and keeping people distant are really, really important for us as we think about trying to get these numbers not just lower, but to get them really at the lowest level possible. So we have a lot of work left to do. And so I'm hopeful that we can do that in Mecklenburg County. And we have really done a great job of flattening the curve. But right now, we really have to sort of kick into overdrive and put on our mask and make sure we're all wearing masks, make sure our family members are wearing them. And again, like I said, keeping our distance.
Absolutely. Yes, absolutely. And Dr. Washington, thank you so much for really giving us the what's what on what's happening, especially here in relation to COVID. And I want your opinion on something. So the CDC says that when it comes to minority groups, we tend to be at risk, severely at risk, and an increased risk from getting sick and dying because of COVID. So the question that I have for you, Dr. Washington, is from your viewpoint, what are the factors that are contributing to the increased risk, specifically for minority groups, African Americans, Latinos? What is the reason for that?
Yeah, that's a great question. And I since the beginning of the pandemic, we have observed these disparities among racial ethnic minority groups, and we've really tried to be very intentional about communicating what's causing that. It's not necessarily because we believe that individuals who are Black or Latinos are more susceptible to the virus because of their genetics or skin color. It's mostly driven by other factors, so external factors, either because individuals are at greater risk for complications due to comorbidities. For example, we have higher rates of things like hypertension and diabetes and obesity in our communities already, and those things certainly make your risk for having complications due to COVID a lot greater. So a lot of people, when they get COVID, they have symptoms, but individuals whose bodies are already some way vulnerable or compromised because of other health conditions, it certainly puts you at greater risk. And so as a community, when we have more people in our community with those conditions pre-COVID, when COVID came around, it just basically spotlighted those disparities that already existed. That's one real reason why. Then another reason why is that people of color often are working in essential jobs, either in healthcare or in essential services like grocery stores or in construction or in public health. Entities, social services, and those frontline workers who have to be in contact with the public every day really puts us at greater risk for being exposed, which is why it's so incredibly important for us to do everything possible to make sure we are protecting ourselves and our loved ones when we do have to go out, when we have to go to work, and et cetera.
Absolutely. Thank you so much for that, Dr. Washington. And so I want to go back real quick to the whole mask up, because a part of this campaign is hashtag mask up Mech, right? So reminding everybody to keep their masks on, even if they're cute. But what I wanted to ask you is, for those who really don't understand the science behind why we wear masks, can you break down what exactly does masks reduce? Is it the reduction of like spit, or is it air? Really break down that science so people can understand why we're being told to really keep our masks on.
Yeah, so great question. So whenever we talk or whenever we breathe, there are aerosols. So there's like droplets that come out of our mouth, and we sometimes we call those spit, but we're talking or engaging with people, those things are coming out, and the virus actually lives in those things. So in our saliva and the air that we breathe out, there are these little droplets that are in those. And that's how the virus spreads to one person to another. So the virus, either we breathe in other person's air, or we actually have contact with their mouth, or we touch a surface that has their droplets on it that just came out of their mouth, for example. And so we touch those places, or we breathe those places, and those droplets come out. And then people pick up the virus from someone else. So what the mask does, it really it creates a barrier in between your face and the rest of the world, and really reduces how much of those droplets that come out of your mouth when you talk are actually going out into the air or falling on surfaces. And so why we want everybody to wear a mask is that so we now reduce the volume of droplets for folks who might be sick and those who are not sick. And so we really slow the spread of the virus by basically having those droplets now, instead of going out into the air on surfaces, they go into the mask, which is why it's not just important to wear the mask. I need to have on a mask, and you need to have on a mask, because your droplets could still go out if I have on one and you don't. So really it's about wearing a mask to protect those other people who might touch your droplets or come into contact with your droplets. And so it's really important. The most effective way, of course, is when everybody has on one, because then everybody's droplets are keeping to themselves, basically. Right. And also having us be 6 feet apart, that lessens the likelihood that you'll come into contact with someone else's aerosols, because you're distant, you're far enough to where when it comes out, it'll fall on the ground. And unless you're rubbing your hands all over the ground, you shouldn't be. And then, of course, the other important thing is because we touch surfaces and we touch doors and other parts of tables and tabletops and chairs, washing our hands frequently, make sure that when we do touch surfaces that may have those droplets, we clean our hands, we get it off our hands, because our tendency is to always touch our face and we don't know it. And so we don't be carrying around those germs in our hands. So that's why mask wearing is so important and really has been an effective tool in our response to COVID-19 here in Mecklenburg. We've seen ever since the mask mandate went into effect, we have seen some really nice declines in those key metrics I described earlier. We believe it's working. And so if everybody just keeps this up, we think it will keep working, and it might even help us in the flu season to come.
Yes, absolutely. And honestly, yes, Judith.
Let's go a little bit deeper on the mask, because everyone has at least one mask at this point. But how do we have to use this mask? How often I change it? What are the ones that actually work? Because right now there is an industry out there with this mask. So tell us how we're supposed to use these things, which one we should buy, who's supposed to use it? Would I put it on my baby, or my kids?
Yeah, great question. So we recommend a cloth face covering for folks. There are a number of types of masks available in the world, in the industry. The CDC just released a study maybe a week ago that sort of looked at the effectiveness of masks, and it really showed that the cloth face coverings, particularly those that are just a regular cloth face covering or have the triple fold that cover the face and the mouth, are the most effective tools, are really effective at reducing the spread of the virus. There are other masks like surgical masks that you see that are disposable, and they're KN95 masks that you see. We really are not encouraging people to get those or to buy those. You can pretty much get a cloth face covering anywhere. They have them at Walgreens for a couple dollars. Those are perfectly fine. Our recommendations for those particular masks are that you just hand wash them every day, so you don't want to keep wearing it. If you go back to my theory around, or logic around why we have to wear them in the first place, it's dirty, right? So you talk into it all day long, it gets dirty. So you want to make sure you wash them very good every day, hand wash them. You can just hang them up to dry. You can also put them in the laundry if you want. But just to ensure that it gets clean and you're not reusing it, and you're not, sort of having, the dirty cloth on your face all day long. So you want to hand wash them. I recommend everybody get a fair amount of them, at least 5 or 6. I don't think we're going to not be wearing these for a while, so you want to make sure you have as many as possible. Like I said, since the beginning of the pandemic, we've been encouraging all retail stores to sell them, to really just get these. I mean, the surgical mask, again, do offer a little bit more protection, but in fact, it's not significant so that you need to spend the cost of buying boxes of disposable masks. It's an undue cost that we don't think is necessary. And frankly, the county is giving out free masks, so we have plenty of cloth face coverings. If you go into the county website, you can find out where you can go. We have these pop-up stands where you'll be able to pick them up for free. But again, like I said, I've seen them in Target and Walgreens, and even 7-Eleven might have like just a couple of these. So feel free just to pick them up.
Yeah.
We need to have a drawer. We have to add a drawer just for masks.
Yes, it's so funny. I put one in my bathroom. I have a drawer that's literally just for my masks.
Yes. CLT.com is the website that you can visit, where you can not only read the information that we're sharing with you guys today, but also find the resources or the places that Dr. Washington is saying that they're offering the free mask for you to pass on. And of course, I'm sure this video is available on CLT and Español, but also on Me CLT, all these platforms. Please share it with the community. This information is important.
Yes. Absolutely.
So, we talk about the 6 feet distance. So while we don't talk about that, a little bit about the public places, where we should be going. The parks are open, the mall is open, restaurants are open, bars, other places. What is the advice of a professional, for all this?
Well, the bars are supposed to be closed.
So, okay, 11, right?
Well, we're not telling on anybody, Dr. Washington.
Yeah.
We don't know anything.
So right now, again, we're still encouraging people to only go out when it's essential, and we understand fully that we can't stay home forever, and that we have to reopen our economy, and we have to support businesses, small businesses, all businesses, and so we certainly encourage folks to go out and patronize businesses, buy your essential goods, and certainly if you need to go to the mall and pick up a shirt, to be on a Zoom call with with shorts on, whatever you need. I mean, of course, those things are important. Again, if people are practicing the basic preventive measures of wearing their masks, keeping their distance when they're going out, just waiting 6 feet, being courteous of their neighbors, I think it's okay to do those things. In terms of going to restaurants, all of our restaurants have been taking all the precautions necessary to space the tables out so that people can sit down with their families and not be close to other families, that staff are protected as well, and that they're wearing masks. When you go into a restaurant, leave your mask on until you sit down and have to actually consume something. So when you're talking to your waiter, just sit down and leave your mask on, place your order. It's going to be harder to talk, but we all are getting used to talking through the mask. But again, really important that you can go do these things, but just make sure you're being careful. If there's an option to sit outside, it's always safer to sit outside. If you go to the park, similarly, just keep your distance. You know, go out, have a picnic, go out, play, tennis or whatever your sports of choice may be. But just keep your distance from others. And like I said, if the worst thing we can do right now is gather in large groups. So you want to just make sure you keep your distance.
Absolutely. Yes, Dr. Washington. And also, so you're really helping us to tap in, especially when we discuss masks, 6 feet, and washing our hands. But there's another element that I really wanted to talk with you about. Let's talk a little bit about following protocol after testing positive. So the truth is that there are a lot of people, unfortunately, here in Mecklenburg County who did test positive for COVID. What is the protocol that you would give to those people as they're healing, as they're getting over it, even beyond the 14-day quarantine time frame? What are some other ways that people should definitely be following protocol after testing positive?
Yeah, so certainly once a person is, once the lab result comes back as positive, you'll be quickly getting a telephone call, hopefully quickly, from the health department. So within a day, you'll hear from us, and we will get into touch with you to sort of explain all the things that you should be doing. The most important thing, once you get a positive lab result, is to isolate yourself from others. And that includes those that you live with. The people that live in your house should also go get tested. If they are experiencing any symptoms, they should definitely go get tested. But the most important thing to do is to stay isolated. It's really hard to do, and we totally understand it. And we have resources available at the county. When you get a call from the health department around your the fact that you've been diagnosed with COVID-19, they certainly connect you with one of our social workers or our caseworkers or our support team to really help connect you to resources if you need things like food or medications or et cetera. And we're here to help with those kinds of things for sure. But the most important thing to do is to isolate and to stay isolated until a nurse tells you that you're going to be released from isolation, which is usually not a complete 14 days from the date of diagnosis, because it starts from the time when you get tested. And then it also considers factors like when your symptoms resolve and how many days from which you may or may not have a fever. So just follow the direction of the staff from the health department as it relates to your specific circumstances. But again, the most important thing is to stay isolated from other people and to ensure that anybody that you've been in touch with, that you notify them. We will ask you for their information, but you can take the initiative yourself. So as soon as you find out you're positive, if you've been in close contact with anybody for 15 minutes or longer and you weren't wearing a mask, just make sure you notify them, hey, you should go get tested because I just tested positive for COVID-19. And that's the way we can do this as a community, right? So the health department, we have a whole team of folks working really hard, 7 days a week, to get in contact with people who've tested positive, but you can do it yourself. I mean, it's really easy for you just to go out and say, call the folks who you may have come into contact with and say, you know what, I tested positive for COVID. I need you to also get tested and quarantine yourself. And that's the kind of community that we want to be a part of. And we really need everybody to sort of be a part of this fight together.
Absolutely.
You mentioned fever as one of the symptoms. We're going to go back a little bit and talk about that. Symptoms of COVID. When should we go either to get tested or to go to the emergency room,
Yeah, so fever is a very common symptom of COVID. It's a respiratory illness, so it tends to affect the respiratory tract, similar to like the flu or the common cold. And so you might get symptoms like a fever or body aches or chills. You may get a runny nose or sore throat. All those are very common symptoms of COVID-19. I must actually take a quick step back to say everyone who has it doesn't have any of these symptoms, and some people have one of them. Some people have 5 of them. And so it's really important to understand that with a virus like COVID-19, all of our immune systems respond differently to it. And so all the symptoms you might experience are going to be different. Fatigue is another symptom. People start to feel really extreme tiredness. So it's important to monitor yourself for any of those symptoms, especially while we're in this pandemic, and to go get tested if you start to experience any of them. Another symptom that's been very common in COVID-19 is the loss of taste and smell, which is a really weird symptom. And it actually happens with other viruses as well, but it really been pretty common with COVID-19, and some people kind of wave it off as being nothing, and I can't taste or I can't smell. I've talked to a number of our residents, especially some older folks, who are like, oh, I just lost my taste buds off this week. That's a symptom, right? And so if you have any of those symptoms, it's really important that you go get tested. And when you go get tested, make sure you wear a mask. And if you start to experience them, you want to stay away from others, right? Because you potentially, especially while you have those symptoms, it's when you're most likely to be infectious. That's when you're most likely to spread the virus to other people. Another symptom that's been common is the GI symptoms. So people have been having things like diarrhea. And again, these are all things that happen from other viruses as well. So it's just important to go. It's better to be safe than to be spreading a virus further to other people, because it could just be food poisoning, or it could be something else. But it's better just to go get tested if you experience the symptoms. For example, a lot of people have allergies in the summertime, and it feels like my cough is just a cough, but it could be COVID-19, and it's better for all of us if we just go get tested if you have any of those symptoms. There's no harm in a negative test when testing doesn't cost.
Absolutely. Absolutely. And I'm so glad that Judith asked that question about symptoms, right? So once symptoms are all gone, right? So you no longer have the runny nose, you don't have, your stomach acting up, you don't have shortness of breath. For those who actually survive the COVID virus, let's talk a little bit about the long-term implications, because this is the part a lot of people don't talk about enough, right? It's like even young people, they're like, well, if I fight it, I'm good. If I beat it, we straight. But could you speak to a little bit of the long-term implications of COVID? So some of the complications that we don't speak enough on, or those things on that.
Yeah, unfortunately, the hard part about speaking about it, that there's just so much we just don't know. And that's what I always tell people, especially young people who are like, oh, it's just a cold, or it's not anything serious. This is a novel coronavirus. It's new. It's not common that coronaviruses are even spread like this in human populations, and have this level of severity of illness attached to them. So there's a lot we just don't know. There are studies coming out every week about the potential long-term complications, about people who experience symptoms for longer periods of time. There's studies coming out about potential impacts, long-term impacts to the thickness of people's blood. Again, we don't have enough evidence, I believe, yet to really fully understand the long-term consequences of the virus, or having the virus. We don't know enough about the immunity that you develop once you have it, if you're reinfected. So I think the hard answer is we just don't know, which is why we're really trying to take every effort to reduce the spread and to mitigate the spread of the virus in our community, because there could be really long-term consequential impacts of having the virus that don't show up for 12 months until later. And so we just want to make sure we're as safe as possible as we're learning. Every day something changes in our work with COVID-19. It's new news every day. And so we keep pushing ahead, but of course want to ensure that we do the best job we can to protect ourselves and those that we love.
Absolutely.
Count on Me CLT is the website that you can visit and learn about all this, and also resources. That's the most important part about this website, that you can find resources, what to get tested for free, where to get masks, what are my symptoms, and what should I do. It's a countermask to bring us together. And it's so true what this website said, is that really it doesn't matter how normal our lives seems right now. The virus, COVID-19, is still out there, and like Dr. Washington said, we still don't know much about it. So let's just follow the rules, put our mask on, keep our 6 feet of distance, wash our hands, and please send your comments and questions if you have any for Dr. Reynard. Even after this conversation is over, visit the website, call the phone numbers if you have any questions in regards to COVID-19. I don't know if you have any other question, Ohivia or Dr. Washington, something that we haven't mentioned in Dutch about COVID-19, rules that we have to follow.
Yeah, so let me give a quick resource and then I'll go back to the rules. If you have a question about getting tested or want to know where to get tested, you can go to the Count on Me CLT website. The county has a testing site locator there on the county mecnc.gov/COVID-19 as well. If the internet's not your thing or you can't find it, you can just call us. The health department is available all day, every day. At that number, you can see there 980-314-9400. And that's a great resource. Our staff man that hotline all day, every day. It is an incredible resource to be able to help you find a testing site or get in contact with one of our health systems to find a testing site. So it's really important. In terms of rules that we should be following, I think we are still in the second phase of the governor's reopening strategy, Safer at Home, which really, I think the title of it really sort of spells out the whole idea of this, is that we are safer at home, the best place, the safest place for us, and there's always going to be a risk. I don't care what the circumstance or situation is. Our goal is to try to reduce that risk as much as possible, which is why we say wear masks, don't gather, keep your distance. But the key things that are important right now really are just ensuring that when you leave the house, you have a mask with you. We should not be in congregate settings, so like large gatherings, parties, places where people aren't wearing masks, bars. We shouldn't be playing contact sports with strangers that we don't know or don't live with, because again, that's an opportunity for us to come in close contact with someone who may potentially have the virus and may not know they have it. So I think those are generally the key things that are important. There are more rules, I guess I would say, for businesses in terms of just trying to keep the occupancy low. As well as making sure that there's space on adequate space for seating if there are a restaurant or some kind of establishment. But those are the most important things right now. Restaurants are open, stores are open, but that's the large of what's open. And I guess I'll throw in that, we're in terms of priorities, we got to remember as a community, right? Our kids are learning virtually right now. And so we really want to make sure that we prioritize, getting kids back in school over, going to athletic events or other kinds of social gatherings or going to bars and parties. That's not as important as our kids' education. And so as a community, we have to think about what's most important to us and really sort of put those things on hold until we're able to sort of move through this process.
Absolutely. Absolutely. Thank you so much, Dr. Washington. I mean, honestly, for me, I feel like I was like VIP to like all this information. I was like, let me ask what I would ask.
Yeah, of course. My pleasure.
Yes. Thank you. Yes, Frank.
And we will share, again, the helpline is 980-314-9400. And the website's too, for you guys just to click. So just share this conversation. And all the resources and all the information will be there for our community. Yes. So I don't know if we have anything else or any other question. I wish people send something, but for now, I think it's just please keep wearing your mask. Mm-hmm. Yep. Keep your distance, wash your hands, stay home. Yes, wash your hands.
And don't gather.
Yeah. Don't gather. Yeah, and that's so important. I have visited other states where right now, we don't want to get to that point in North Carolina or Charlotte, but right now, if a gathering is reported, they take out the electricity and the water for 48 hours if a gathering is reported. So we don't want to get to that. No, we just...
No, and the other thing about it is that there will come a time again where our community will go back to some of those things that we used to do, right? This is temporary, but we need to reduce the spread of the virus sufficiently so that we can get back to those kinds of interactions in a safer way, probably a little different way, but we'll get there. We just need folks to stick with it for now.
Yes. Absolutely.
Well, Olivia, thank you very much.
Thank you all.
For talking this with me. Dr. Washington, thank you for all the information. And to everyone, please follow the website Count on Me CLT, where more information will be sharing We will have more conversations about this. We have to talk about education in COVID's time, parents as the teachers, that everyone right now is a teacher, you know, even the babysitter. Also, economic, how many small businesses in Charlotte are closing because we are not aware about what kind of grants do we have. And also, how many people keep saying 2020 is my year, I'm going to launch my business. It's the right time to do it, or it's not the right time to do it. So we're going to keep this conversation in English and Spanish. So make sure that you keep connected with Count on Me CLT and with CLT and Español. Thank you very much.
Thank
Gracias.
you guys. Look forward to talking to you again.